Hi, my name is Zara Durrani, and I welcome you to the first annual International Hair Restoration Platform Conference taking place here in Vancouver, British Columbia. We are very honored and pleased to have here with us the founder and creator of the world's famous FUE technique, Dr. Ray Woods. You came in all the way from Australia. Thank you so much for joining us.
Well, thank you very much for having me. It's an honor to be here.
What was your journey like getting here so far?
Well, it was long.
And you haven't been to Vancouver in a long time.
I've never been.
Oh, you've never been?
No, I've been to the United States several times, but not to Vancouver. Lovely city, great place, very liberal.
Wonderful, good to hear that. Now, you are one of our keynote speakers. A lot of people are here. A lot of doctors and surgeons are here from around the world. They've come here specifically to hear you speak, to connect with you. And as far as I'm aware, I've heard that you don't just go to any conference, any platform that exists out there. Is that correct?
Well, no, I haven't been seen in public like this since 2005, although I've made my presence known on various forums and putting out information and getting into feisty debates with various people saying various things and trying to educate the public as much as I possibly can, which I believe I've done over the years. But yes, when I was first asked to come to this conference, my immediate answer was no, I don't do conferences because it can get very controversial and I don't normally hold back what I think. But I thought, well, why not? It's about time. So here I am. So it's going to get a little bit fiery tomorrow.
Oh, wonderful.
I was holding back today.
Oh, good. You're just warming up. You're just
I'm
scoping things out.
I'm just warming up.
That's good to hear. And
so I gather you guys are going to have me on the first flight out of here tomorrow afternoon.
Not at all. I was in Brussels last year for the FUE conference, and it is an honor to meet you and to ask you questions. Like, I'm not a doctor or surgeon myself, but to meet doctors flying in from around the world who are here to see you speak and for you to share knowledge with them. What is that like for you?
Well, it's great. I obviously I have intellectual property, which is currently considered for patent and all that sort of thing, which I obviously cannot talk about here, but a lot of the generalities of FUE and BHT and a lot of the harsh truths and a lot of the suspicions and a lot of the things that need to be said, which some people possibly won't be comfortable with, have to be said. I enjoyed Dr. Musanga's talk. He echoed more or less what I was saying, and it's time. I think that I came out more and started pushing more of my beliefs and what I've learned over the last 25 years, or how long has it been now? 89? What is that? It's been a long time. So. No, I'm very happy to talk to people, but like I said, it's not always when I get told that things happen. I've seen people from all around the world for a long time, and the biggest thing that's always annoyed me is the numbers racket, which people pump up their numbers of how many numbers they're doing per session. So it's globally competitive, and somebody might say this number, somebody will leapfrog and say that number, and patients unfortunately sort of think they're going to the guy who's giving the most grafts per session at the best price, and the reality turns out to be quite disappointing in many cases. I guess I've always said that on the forums, on the internet, but coming face to face with people and saying, look, I don't think that's right. And if it is right, it's easily, you can confirm it very easily. It doesn't take a lot of technology. It takes about one of those cameras, and say, well, am I providing what I promised I'd provide? Is this transaction rate true? My primary goal being here is that the patient deserves to know what they're getting what they paid for. The follicles are irreplaceable. They're never going to come back again. If you transect or damage, it's over. So if the patient cannot see and be aware and be informed of what they're getting, they just have to take the doctor's word for it. And as we know, disclaimers and all these things happen where basically they say, well, I'm promising you the world, but the fine print says if it doesn't work out that way, tough for you, and you can't do anything about it. So it's caused a lot of problems between me and many, many doctors over the years, mainly online. And back in 2002, 3, 4, and 5, it got quite aggressive. But I stuck to my guns and said, well, this is the way it is, and there you go.
So you're putting the patient, the client, first.
The client has to be first, and the client, I would never allow anyone to operate on my hairline if I was not watching that screen and checking to see that everything I was promised was happening. And like I said, it's not great, it's not amazing technology. I've got the greatest and best Carl Zeiss overhead microscopes money can buy. But you don't have to go that far. These days you can get a decent macro camera and say to the patient, here you go, watch. Give them a little clicker and see, are they getting that number? And then they say, well, it all gets complicated because there's 6 pairs of hands on your head. Now, I don't know about you, but your head's about this big. How do you put that many hands on a balding area that big? Well, the truth is, you can't. So one of the big problems I've had over the years is patients turning up with hair going in all sorts of different directions. Now, why does that happen? Because the technicians are working extremely close with very, very sharp instruments, very pointed, very pointed. So, in order to avoid stabbing each other, they got to do different, for practical reasons. You have to stay out of each other's way, and in doing so, you're compromising the result. And I've seen countless examples of that. So I'm a firm believer that you really can't stick any more than 2 hands on someone's head and get that directionality correct. Because the more hands you stick on someone's head, sure, you're going faster, but the angles cannot be controlled. And they can't be. I mean, you can't have 2 hands here and 2 hands there and punching home. You're all over the place. And so you've only got one crack at this or a few cracks at this, and you must get it right because your whole life can be affected. A man with a bad hair transplant wears a cap for the rest of his life. Relationships fail, job opportunities disappear, self-esteem dwindles. It really has a very, very, very significant and horrific consequence if it goes wrong. So I know exactly what everyone else is doing, and I can do it. I can hire techs and say, here, go ahead. Get a drill and just go for it. But I know that a lot of that's going to be transected, and I know that the directionality is not going to be correct. And you can showcase good results here and there, but we're seeing the tip of the iceberg. I'm seeing over all these years what's actually happening underneath that iceberg, the real
And it's
tragedies.
good to hear that from you because you created the FUE technique. So do you get a lot of doctors and surgeons contacting you wanting to learn from you specifically or wanting to come and apprentice under you, assist you?
Well, back in 2002, 3, 4, and 5, we were in Santa Monica and New York conducting seminars, but I had very strict rules that if I was to teach anyone to do this technique, they had to sign a legal document with me that they were going to play by the rules and do this correctly. Otherwise, they're doing the Woods technique, which could potentially be damaging people if it's not done correctly. It's just like someone opens a McDonald's franchise. You can't go starting
Your own way.
and doing. It's got to be standardized and done correctly, something that works. Not that I'm a fan of McDonald's, but I wanted to make sure that anybody who I trained was going to do it exactly the way it's supposed to be done, and I needed a contractual obligation to that. I didn't want any money for it. I said, I'll do it, but it must be done that way. And guess what? Back then, nobody was interested. They said, this is too hard. This is too long. Just give me a training session for a couple of days, give me a certificate that I signed you off, and off to work on Monday. And that's just ridiculous. It doesn't work that way. But over the years, I have developed and refined instruments which now has taken a lot of the guesswork out of it. That's part of the reason that I'm here. We spend a lot of time, a lot of effort, a lot of money where I can actually take someone with good hands and the right ethics and say, look, this approach and this instrumentation takes a lot of the guesswork out of it. It's still manual, but this could work. This could work. I believe it will.
I sound like what I'm hearing from you is like you have a strict moral and ethical code in terms of when you're doing the work, and especially if you're training the doctors or you're showing them your technique, that they're doing not just trying to get the patients in and out, but actually doing it in the way that the customer, the client, the patient is happy, and you're doing it in the best way possible instead of trying to just focus on the profits.
Yeah, that's absolutely true. It's very hard for me to bring in a patient and they say, well, Dr. Woods is only offering this many grafts per session. Another doctor is offering 4 times as many grafts per session. And I'll be quite clear about it. I say, well, are you allowed to see those grafts? It's not, you don't have to be a brain surgeon or a rocket scientist. You can see it. The bulb, the lining, the gland, under high power on a big plasma screen, it's all there. And you can see it. You can see what's happening to you and how it's happening to you. And every patient, I believe, has the right to see what the hell is going on. Because this industry, let's face it, does not have the best reputation. It's actually harmed and done more damage to men than any other branch of medicine that I know of. And it's totally unregulated. So I tried to unsuccessfully introduce some regulation. It didn't work. And so now Tanya was very persistent, and I said, well, okay, I'll come around and just test the waters and see what's going on. But yeah, it's very hard to tell someone, I'm giving you less grafts, but there's no damage, and they're all perfect, and there's hardly any transaction, and I'm not over-stressing your head, and I'm not damaging your donor, because if you do, it's over, and you're in big trouble. So I get a bit annoyed when I hear people toss around big numbers, and I think, well, I know for a fact that doesn't work. I mean, I've tried, drills. I've tried all that stuff, and I know without depth perception, angulation perception, and that field micro proprioception, you are going to get into trouble because every head's different, and every different areas of the head are different, and you have to adjust and adapt. And you have to do it under an incredibly powerful magnification. I use 8-power loops at 190 mil. I'm this far away from the patient, but it's at 8 power. It's equivalent to 25 power, let's say 300-400 mil further away. So it's pretty darn powerful, and you need to see it and know it, feel it, and get it out correctly, because it is priceless. It'll never come back again. Once it's gone, it's gone. Same thing with putting it in. Just punching holes and jamming follicles in, it can hurt the follicle because it's so fragile.
And I think that's what the clients, the patients, they need to hear.
Well,
so
yes.
Everything that you're saying, I feel like it's information that perhaps is not out there, and people need to hear this information before they pick which doctor to go for such an important and perhaps life-changing surgery.